Hey Renee, how are you?
Hi, doing great. Thank you. How are you today?
I'm doing awesome. I'm doing awesome. It's great to connect with you. And this is a podcast I've been looking forward to because it's not every day that I get to come across a functional medicine practitioner who has spent over 20 years as a pharmacist. And yeah, that's kind of one thing I'd like to start with is you spent over 2 decades helping people as a pharmacist, and now you're helping them heal through lab work and lifestyle changes. And
hmm
um, I'm just curious if we could start and what opened your eyes to a different way of practicing medicine?
Yeah, absolutely. It's kind of interesting. I was rarely, I'll say early in my career, I was a traditional pharmacist working for a chain drugstore. But for most of my pharmacist career, I was in the compounding industry, which is customized medicine, personalized medicine, everything that patients need that they cannot get from traditional medication. So I feel like just by being in that world, the emergence into functional medicine was so natural. And, really, as I started to learn more, I heard many functional medicine practitioners just, share about their patient cases and how they were able to help patients, feel better with lifestyle, supplement, food, sleep, all of the things. And these practitioners were even able to help get patients off of their prescription medications, or at least reduce them too. So I thought that that was quite unique. And then as a pharmacist, knowing how these medications all work, um, working with practitioners to taper down the medications as needed, and things like not stopping abruptly, things like that. So it, I think, really gives me a unique perspective to work with clients from both the pharmacist side and functional medicine, health coaching side.
Oh no, totally. Yeah. And it's interesting because when you talk about like people stopping stuff abruptly, that's one of the things that came up as I was doing like searches for social media was like, how to get off of prescription medications. What can I supplement naturally to replace it? So I think there's this
Mm-hmm.
desire of
Mm-hmm.
people to kind of get off of that hamster wheel.
Yes. Yes.
Um, and before we started the podcast, you were sharing that you really started to dive deeper into the functional medicine side of things, like right, around like the pandemic. And I'm curious, like, what is something that you used to believe as a pharmacist that, as you've learned more about the functional medicine side of things, has shifted the way that you look? Like, what is something you used to believe then that, like, maybe you have a different perspective on today?
I mean, pharmacy school is 8 years, and well, pharmacy school itself is 4, and then undergrad is 4 prior to that. Plus, I was a pharmacy technician working for all during pharmacy school and undergrad. So I've always been in the pharmacy world, and you believe what you see, you believe what you're taught, and until you really start thinking outside of the box and hearing different perspectives, um, I just always believe that, wow, as a pharmacist, my job is to dispense medications, FDA approved medications that the doctor prescribes, and talk to the patient about how to use the medication, side effects they may likely encounter, and that kind of thing. And so that has completely shifted now to, yes, there is FDA approved medications are super important. I mean, thinking about, wow, if someone has a very serious infection, or you have an accident and, you have a broken bone, I mean, in surgery, I mean, if you're going to need antibiotics and pain medication and things like that. So it's that acute care that still needs your traditional medications. But it's more so what really has changed is my approach to chronic medications, chronic care. So things like helping people with blood pressure, cholesterol, diabetes, that kind of thing, from a true medical perspective. And then that's shifted. And then also helping patients that may just not feel right, may not have the energy, may just think, there's something else going on, and all my doctor wants to do is put me on an antidepressant, and I don't really want that. So so now, the shift has been, what can we do first before we look at prescriptions that, once in a typical world, if you're prescribed a statin for your cholesterol, you're basically going to be on that for the rest of your life. And so that's what I don't want to see with my patients.
Oh, no, totally. And it's something that I could relate to myself, where in my family, there's a lot of them that they hop on one medication, it causes side effects, and then they get on a secondary medication to kind of handle that. And,
Right.
It spirals out of control a little bit.
Right.
So that makes total sense. That instead of just treating symptoms, you kind of look at, okay, what's the root cause of this? And would you mind, like, just maybe sharing like a pivotal patient moment for you where it sort of confirmed, like, this is the kind of medicine that I want to practice?
Yeah, for sure. And I'll just kind of preface it by saying she was not my patient, but
Okay.
it was such a pivotal moment. I say she wasn't my patient. She was under care of other practitioners, but I became someone that she talked to every day about what was going on. But so I had heard functional medicine speakers, presenters. I had interactions with functional medicine doctors through my job as a compounding pharmacist. And when this friend, she basically came down with all of these symptoms that were just, she went from being a vibrant, healthy person to extreme brain fog, extreme fatigue, extreme joint pain, rashes, like just all this stuff. And, her doctor after doctor after doctor didn't know what was going on. And so then she was able to get in with a functional medicine practitioner who was able to diagnose her with Lyme disease and all these co-infections. So that was when I was like, you know what, there's so much more to functional medicine that I don't know. And so that's when I decided to go back to school and get the functional medicine certification. And so I did that. That was a 4-year program through the School of Applied Functional Medicine. And so that's when I was like, there's just so much more that I need to know to be able to help people in a different way. So that was kind of my turning point to really transition.
That's amazing. And it's interesting because there's this common theme that I'm finding, whether it's with friends or searches in social media, where like normal tests, normal blood work are coming back as normal, but people, like, they don't feel normal.
Right.
Now that you've kind of gotten into the functional medicine side of thing and looking at root cause, like, in your opinion, what are doctors missing? Like, what are some common things happening that they're like dropping the ball on?
So kind of like what you were saying about the lab tests, as this is kind of, I'd say, recently become one of my areas of expertise, is because, functional medicine tests are typically not covered by insurance. They're not super cheap. And they are important, especially when there's, just very difficult cases. But so much can be learned from traditional lab tests that, primary care doctors run. And so that's kind of what I've gotten into. But, back to your question about what are they missing, they'll run a panel and just look at it and look at, okay, what does the lab say is high, low, or if nothing is high or low, then everything's fine, you're normal. So if you, kind of really think about it, normal is what is average. So is, based on the population at the time, what is average, plus or minus 2 standard deviations is normal. And then you fall in that normal range, but that may not be optimal for you. Your optimal may be closer to the midline. So I kind of look at it as, are your labs coming back as suboptimal? So it could be suboptimally high, suboptimally low. And it's not your, traditional primary care doctors don't think about things that way. And so also one of the things that I like to do is look at trends from year to year. So if I'll give you a really good example of, let's just say they come back with their fasting blood glucose, and it's 90 a couple years ago, and then it jumped to 95, and then 99, and then 105. So that's definitely trending in the wrong direction. But if a traditional doctor is just looking at it and it's like, yep, that's good, everything's normal, then that patient may not realize that they are on the path towards prediabetes, diabetes. Yeah. And there's things that we can do now, to work on that, to help, prevent that from happening. So, on the other hand too, you could have a diagnosed diabetic patient whose levels they're working really hard. Their levels are continuing to get lower and lower and lower, but they're still, quote, high. And they may not get the praise that they deserve for working so hard to get their levels down. So I definitely look at things on a personalized patient by patient basis, and not just on what's, quote, normal or what the average population is.
No, I love that you do that, because it's interesting. Like I've heard conflicting stories on, there's sort of this standard for what the ideal sort of measurements are. Let's just say something simple like blood pressure, but it sort of depends on so many other factors, where, I've heard that the 120/80 is no longer really ideal. It's more like a 115/75. But I love how, for like blood sugar, et cetera, it's like, okay, what are they trending towards? Because if they're trending in the right direction, that should be celebrated and not feeling like they're failing again. I love that. That makes a ton of sense. And that's one of the things I think is like a common misconception or a thing is, okay, functional medicine isn't covered under my insurance. It's generally an out-of-pocket thing. And there's this idea that like taking control of your health and getting yourself on the right track either costs a ton, or you need to be on a boatload of like supplements and, crazy expensive like protocols. Like with you and your clients, like your patients, how do you approach this in a way that's still like accessible and approachable for like a normal person?
There's so much that can be done without having to do these expensive lab tests. And kind of going back to the Lyme disease patient, that did require a test, and it $400-$500, but that enabled her to get that diagnosis. But on the majority of my patients, unless there's something that they really want, there a lot of times there's not a need. I have done, and I do sometimes recommend patients to do a food sensitivity test, and that that does have a cost. That's very different than a food allergy test or an allergy test that a primary care doctor may run or may do, which is often a lot of different like pricks to see if your body is reacting in that specific area to a certain thing. So the food sensitivity test is very different. It's something that patients can do at home, and they called it a dry blood spot test. So you basically just prick your finger, and then you put blood on these markers on this card, send it in, and then you get back your report with what you're sensitive to. If people can't afford that, don't want to do that, it's super less expensive to do just a food elimination diet. So, people have to really want to figure out what's going on, food elimination diets, even I like to do 30 days. If someone can't do 30 days, if you can do 10 days, and then patients will really start to feel better. And then you can kind of add back in very, very slowly, very intentionally what those foods may be. So, I mean, most common food sensitivities are gluten and dairy. So, but I'll just use myself as an example. I did this. I was on a very, very clean whole foods diet for 30 days. And I still had my symptoms, you know, with the occasional brain fog, the rashes, that I'm like, okay, there is something else there that's not gluten or dairy, processed foods. I don't know what it is. And so I did the food sensitivity test, and it came back my highest sensitive food was carrots. So, which is kind of odd, because you're like, oh, carrots is a health food. And of course, when I'm trying to eat whole foods and be healthy, I sure did snack on a lot of carrots that month. And so there we go. So once I took carrots completely out of my diet, my symptoms went away. So it's kind of amazing. And then, you know, other people have other weird ones too, like to limes or lettuce or, you know, tomatoes. But I'd say for the person that is like just on their own, wants to try to do something, definitely start, you know, eat whole foods, no processed foods, take out gluten and dairy. And that should be a very good start for the majority of patients to really start to feel better.
Oh, that's incredible. Yeah. In your opinion, what do you think is at the cause? Like, I struggle a lot. Like, same thing. Dairy is not a friend of mine. Gluten, every time that I'm like, oh, I want to live a little and have a piece of like pizza or something, it just haunts me like crazy. Why do you think that is? Because I've heard of people that like go to Italy and they can like eat a lot of this stuff and not have issues. Do you have any personal opinions on like why that is or what's going on?
Yeah, so I'll kind of take that in two parts. So why might we have this? And gluten here in America is hybridized. It's GMO. It's, you know, sprayed with glyphosate, Roundup type product. So it's very, very bad for our gut. And so it ends up essentially creating what we call leaky gut, or enhanced intestinal permeability is the true medical term for it. When you have enhanced intestinal permeability, your tight junctions, instead of being tight, they're loosened. And so that allows undigested food particles to get into your body where they're not intended to be. That's what leads to the reactions. Now, you know, some people may have stomach issues from gluten, and then other people have they don't believe that they have a gluten sensitivity because they don't have any stomach issues. But gluten sensitivities can really lead to the joint pain, the brain fog, the fatigue, the rashes, that kind of thing. And it's, you know, it's likely because of the leaky gut going on. So is there, you know, healing leaky gut is definitely something that can be done. And should patients stay off of gluten? Probably, you know, but it's a decision. I mean, of course, if it's a big birthday celebration and, you know, we want a piece of cake or something, then, you know, that's a decision, and that's something that is definitely a treat and not a daily norm. So yeah, so kind of going back to 100% agree with you on going to Italy and being able to eat the food over there and not have the issues. And it's, you know, the way their wheat is grown without all the genetic modifications and pesticides and all of that we have here, or I'll say that's allowed here in the United States, is quite different. So I've had the exact same situation, you know, going over there and being able to, and, you know, very excited to have lots of bread. So, and I, you know, had no issues. So, and I have heard that time and time again.
No, thank you. Thanks for clarifying. And then, yeah, now I want a vacation in Italy really bad. Um, uh, so obviously having these types of foods that cause sort of an inflammatory response or stress on our bodies is a big kind of focus of what you try to help people do. Um, in terms of like lifestyle, one of the biggest things, so I put out a question, and kind of the biggest thing that people were asking was around like struggle sleeping, like just feeling chronically lethargic, not getting a good night's sleep, super stressed out like during the day. So I know it's kind of a broad brushstroke question, but what are your thoughts around like the role that like stress and sleep has on health and well-being?
Yeah, I mean, stress is, I think it's just, that's practically the norm these days, is for people to be stressed, feel stressed. And stress is like almost become, I don't know, a badge of honor, sadly, if you will. Like, everybody has so much on their plate, personal, professional, that everything is just going on in life. So definitely taking time, being more mindful. And I always say prioritize sleep. I can't control, if like someone has, 3 kids at home and they work full time, and then they have to take their kids to practice and try, they know that they should cook a meal at home and not run the kids through the drive-through for dinner. So is that stressful? Absolutely. But so I do recommend, take time for yourself after the kids are in bed, and don't just mindfully scroll through Facebook or binge watch a show. I mean, just be intentional about that time, whether it's mindfulness or meditation or, yoga, relaxing bath, whatever it may be, just to help to bring your body into more of a calming state. And that will help with sleep. Now, I do have a lot of clients that are on supplements to help calm the brain down to be able to sleep. So kind of depending on whether it's like I'm wired and I can't even get to sleep, I put my head down on the pillow and I have racing thoughts. There's different supplements for that, versus I fall asleep right away and I wake up at 3 a.m. and I can't go back to sleep. Unfortunately, that's probably more, sleep issues is probably more of the norm now, and it, because of all the stress. So I have tools that I recommend, and then supplements as well, because prioritizing sleep is so important. And I'd say probably, 10 years ago, you really didn't hear about that. It was like, what, everybody says get 8 hours of sleep. Why? I'm like, I get 6, I'm fine. Or sure, I'm tired and I sleep in on Saturday. But now it's like more and more realizing that sleep helps the body to heal. So whatever is going on with your body, sleep is so important. And if it's not sleep, then rest. So, if you're in bed, that and trying to go to sleep, that, can still be helpful too. So, I do recommend the Calm app. It's like a guided meditation, which works well for people that are like, I can't just sit and be for 10 minutes. So, the guided meditation is the voice in your ear directing you what to do. And then some of the supplements I like, L-theanine is a really good one, just to help the body to relax. There's a GABA is another one that helps the body relax. And then there's some really good combination sleep supplements that, have a lot of just calming herbs in them, that really help as well. So yes, definitely sleep is super important.
Those are awesome tips. And it had me thinking back to when you were saying that like people sort of wear stress like it's a badge of honor or something. And one of the words that I think comes up a lot when people are thinking of someone who's chronically stressed is cortisol.
Yeah.
And I thought I read somewhere on your site, maybe I didn't, but where you could actually like test for cortisol.
Mm-hmm.
I'm wondering, like, for anybody who doesn't know, because we hear cortisol, but it's like one of those things that's out there. Like, why is cortisol like such an important hormone to like watch out for? And what are some like sneaky signs that it's like way off, even if people don't necessarily realize it?
Yeah. So cortisol goes kind of in a diurnal pattern. So your cortisol should, be high during the day and low at night. So when cortisol is low, then it helps your melatonin be higher so that you can sleep better. So the problem arises when people don't have that normal cortisol curve, and it's super high like throughout the day, or even it could be low during the day and they're tired, and then it raises at night when they're trying to go to sleep. Yeah. So those are just kind of some patterns. So yeah, so there's a like a 4-point cortisol test. It's actually a saliva test. So you can do it like during the day at your house. And so you would do it, in the morning, midday, mid afternoon, and night, to kind of just see at that specific point in time where does your cortisol fall, and seeing, okay, so yeah, so if my cortisol is like super super high at 3 p.m., what is going on in my day at 3 p.m. That was really causing that, instead of having it start to be on the downward slide. So is it maybe for moms with young kids, is that when the kids all get home from school and you're like going crazy, helping get with homework or whatever? But whatever it may be. This is it's an easy test to do. It's actually not that expensive. I can usually talk people through it, and kind of I can predict likely what it's going to look like. But some people are like, they don't, whether it's the cortisol, the food sensitivity, whatever, they need to see it on paper before they believe it, or they just like data. Like I like these tests because I like to see, I like to know what's going on for real. And also too, then you can see, okay, so I have my cortisol was jacked, and I've tried, really hard to get it to normal. Okay, so then, in a year or so, do the test again and see. So I will tell you, it took me 18 months to get my cortisol back to having a typical diurnal curve. Wow. So it's not a super quick fix, because when your body is in fight or flight, and you're like, oh, I'm going to be good and be calm and do my supplements and do my meditation, for 2 weeks, and then think I'm going to be better. And your body's like, no, we were stressed out for like 10 years. Like, what makes you think we're going to, change? I mean, and, your body's like, I don't know that I believe you quite yet that this is going to be your new norm. So, your body stays in that state of fight or flight, which is not a good place to be. But instead of, back in the old days when it was like, you've probably heard this analogy, like, oh, I'm being chased by a tiger. So that's your, fight or flight. Cortisol goes up to help you with that battle or to run. And then it's over, the tiger's gone. And then, your body goes back to normal. But now we have, our tigers, if you will, are completely different. Whether it's, the traffic, the childhood trauma that we still hold on to, maintaining the house, the bills, the politics, whatever it may be for that person. We are just staying in this sympathetic fight or flight state instead of being in a calming state. And so when we're not, I'll just kind of go a little bit deeper into this, because this is what I'm seeing is when people are staying in that fight or flight state and cortisol stays high, that is a huge contributor to belly fat. that, women are like, I've gained 10 pounds and I cannot get it off, and it's all right here in my belly. That's cortisol. So, I have so many, like my clients are like, I'm gluten-free, I'm dairy-free, I'm doing all the things, and I can't get rid of this. And it ends up being because of cortisol.
Gosh, yeah, that sort of resistant weight loss sort of issue where there's that sort of pooch or whatever that people can't leave, love handles, whatever that people can't get rid of. That seems like something that a lot of people struggle with. And so it being related to like elevated cortisol levels makes a lot of sense. So with this background as a compounding pharmacist, as a pharmacist, I'd like to get your take for a little bit or for a second. There's a lot of hype around like GLP-1s when it like drugs like Ozempic, especially for like weight loss. And I think so many people, it seems like they want to turn to a quick fix to sort of solve something. So I'm curious, like in your practice, in your world, like, are you seeing these show up where like people are starting to inquire about them or use them? How do you like, what do you want? What do you sort of hope people understand before jumping into something like that?
Yeah, that's a great question. And you're right. It is all over. In compounding, I'll say one of the things that I do like about being able to compound GLP-1s is that we can compound them in much lower doses. So you're not stuck with the Ozempic, which is the injector pen that is just one dose, and that's what you get. For a lot of patients, that's quite strong. And they may have a lot of GI side effects from that, and perhaps they are overweight, and it is contributing to their health conditions, and they do need to lose the weight. And so, can that be a jumpstart? Absolutely. And then, instead of being on that for so long, is there time where you can get on a compounded medication to get that tapered off? Yes. But I do have patients that are on Ozempic and the like, and my like number one rule is you have to prioritize protein and you have to weight train, and those are the like non-negotiables, because if you don't, you're losing so much muscle mass, and that's what your weight is dropping. And I mean, sure, yes, you're losing fat, but you're also losing so much muscle that when you get off of it, the metabolism is messed up. All the weight gain rebound is going to happen. So, but yes, super, super common. I don't, because I don't, I don't prescribe medications. I don't put anyone on that. But I have recommended them to go to their practitioners to look at microdosing as an option.
Okay. No, that's great insight. And I have a friend who hopped on it. And that was always my underlying concern. And the thing I warned him against was like, make sure you work out, but then also adjust your lifestyle. Because if you don't make the underlying changes, then you're on that either forever, or it becomes the new twist on a yo-yo diet, if that makes sense.
Yeah. You have. You have to. I mean, it's like, doing it in conjunction with eating the right foods and changing it, from not just like, oh, I'm not hungry, but sure would love some junk food, carbs, whatever. And unfortunately, they could still eat that way and lose the weight. So then patients tend to think, oh, well, why not keep doing it? If I'm going to eat cake and still lose weight, then why should I, worry about? I'm like, no, you need, like, the only thing in your mouth needs to be protein. And then if you still have room in your stomach and, whatever, but definitely you have to do the proteins.
Oh my God, totally. Kind of sticking with sort of your pharmacological background, I would imagine you're in a very unique position where you can literally work with your clients to kind of rebalance their whole medication protocol over time. Like, just from your perspective, when do you like focus to like keep somebody on a medication, and when do you work to replace it?
Um, I'll let me use thyroid kind of as an example. So, people with that, diagnosed with hypothyroidism, are on thyroid medication. So it could be a commercially available product. It could be compounded, just depending on what they need. Um, so there are ways to, I guess, help your thyroid to work more optimally. But it always depends on what the underlying cause is of the hypothyroidism. So if the patient has hypothyroid, or I keep saying hyperthyroid, if they have low thyroid and they're on their thyroid medication to raise it up, what's going on with that? What's underlying? So do they have Hashimoto's, which is an autoimmune condition? So if they have Hashimoto's thyroiditis, do they need to be on their thyroid because of the autoimmune condition? So if that's the case, then if we can work on the autoimmune condition, figuring out what's going on there, figuring out the why, then, okay, is it possible to taper off, get some of the more supplements in? Then possibly. So it really depends on that, but it is working closely with the practitioners, their prescribing doctors, to be able to say, okay, we're going to try to do a taper. Otherwise, with diabetes, it's kind of the same thing. It's like, gosh, now we've been working so hard. We've got you eating right. Now your fasting blood glucose is slowly coming down, but you're on your same medication. So now there's that risk of hypoglycemia, which we don't want at all. So, in those type of situations, it really is, I'm giving recommendations to their, prescriber, their primary care doctor, whoever it may be. And so I always tell them to let them know that, they're working with me, so that, and what their goals are, so that their doctor knows, and, we can kind of make recommendations together.
That's amazing. That's amazing. A couple just more questions. I know we're kind of getting to the time, and I really appreciate I'm really enjoying the conversation. Three more questions if we can. One that I just was personally curious about is, like, what's one thing that you've changed in your own routine in like the last couple of years that you feel has made like the biggest difference in how you feel?
So I have recently stopped gluten. That's been, I never, kind of like what I was saying earlier, like it never affected my stomach. So I could eat it and it was never an issue. So so now it has become an issue, and I can totally tell. And I think it's hormone related. So perimenopausal stuff going on. And also too, one thing that people may or may not talk about is COVID-19, that whether you got the infection, got the vaccine, whatever, the virus itself, it just does some weird things. Different people, some people have long COVID extreme issues. I kind of noticed between that and my hormone changes, gluten affects my joint pain so bad. And so if I don't have gluten, I don't have any issues. And wow. When I, like you said, when I make that decision, if I go get pizza, I know what the ramifications are going to be. And that's a decision that I have to make. But it's, so much of this is just, I think it's just empowering patients to know. So many, doctors just don't give patients enough time. They don't educate them. they don't have time. It's not their fault. I'm sure they want to. That's what they went to school for as well. But it's taking the time to educate, empower patients to take control of their own health, and learning, asking questions, listening to podcasts like yours, just to be able to say, okay, I know that I could be feeling better. I want to feel better. What's going on?
Well, number one, I really appreciate that answer and all of that insight. That had like so many golden nuggets in it. I hope the listeners picked up on that. On a personal note, you got me stressed that I'm going through perimenopause, and I'm joking, of course, but I had a burger for the first time in a while last night, and instantly I started like having a lot of phlegm and like coughing a lot, and I had like almost like an allergic response to it in that way, and it was me just saying, okay, that's something I can't have. My wife kind of struggled with that too. Like we both had a bit of a response to it. But you actually, it was interesting. In your answer, you tapped on something that was probably the most asked question when I was kind of combing through social media, like what are people trying to like find the answer to? It was related to long COVID and mystery symptoms, just issues coming up left and right. Just from where you sit, are you seeing that come up with any of your patients? Do you have just any sort of musings or tips for anybody that wonders, am I experiencing kind of offshoots of either, getting COVID, having the vaccine, whatever, that you would just sort of enlighten us on?
Yeah, I'd say kind of initially, as people were coming off of having COVID, it was like the brain fog, like I just can't think, I'm in a tunnel.
Yeah.
Fortunately for most people, that did resolve. Kind of just in my research, my learnings, a lot of it comes down to the mitochondria. So the virus is affecting the mitochondria, which affects everything in our body. So traditionally, if you took a biology class, you'd learn that the mitochondria is the powerhouse of the cell, and it does, but it affects so much. So supporting the mitochondria, just with supplements, with these lifestyle things that we've talked about, and then because of my role in compounding pharmacy, there is a compounded medication called low-dose naltrexone that has been super, super helpful. It's a prescription. Okay. It's super, super helpful that patients have used. So it's whether they have long COVID or autoimmune conditions, especially really benefit from low-dose naltrexone. So I know we don't have a lot of time to get into that here, but there's a lot of research on it. There's a website, LDN Research Trust, that has just plethora of studies, and then I think even like finding doctors on there that know about it and can prescribe it too.
Well, that's rude. Is it mitochondria support? Is that like its main function, or is it kind of helping with the autoimmune responses?
It helps. It helps with the inflammation and the autoimmune responses. So with the mitochondrial support, it's more supplements. So things like CoQ10, alpha lipoic acid. There's like a 5 supplement protocol that can be super helpful. Another thing too that I've found that has been helpful is electrolytes. So having patients use, we always talk about hydration, which is you and I haven't talked about that here, but people may hear it like, oh, they know I need to drink my water. And so I think it's prioritizing water, but then also helping your water to get incorporated into your cells, so that your cells are hydrated in your body. Sometimes that requires electrolytes. So I don't have any affiliation with this company, but the ones that I like, there's two different brands that I like, but one is Element, and it's LMNT, and they just kind of have different flavors. So it's salt, potassium, and some of them even have a little bit of magnesium in there. So it's just different combinations that really helps to hydrate the body. And I had just one client in particular that was her biggest issue, was like, I just am so tired. I'm used to being vibrant and healthy, and I can't, like, I just want to take a nap in the afternoon, and I know I need to go for a walk. I want to walk my dog, but I just can't. And what is going on? And she came to me and was like, I'm ready. Like, let's work together. I want to change whatever I need to, run whatever tests you need to. Like, money's not an issue. And we didn't have to, because I looked at her labs, her traditional labs from her doctor, that the doctor said was normal. And I'm like, you are dehydrated. So let's start with that and see. And it was, like a week later, she was like, Renee's a miracle. Renee's worked a miracle. And I'm like, that's all it was. It was, so sometimes it's really easy. And sometimes there's patients that are very, very complex and do have complex chronic conditions, that are, continuously being worked on from functional perspective as well as traditional perspective too.
No, absolutely. And as I'm kind of thinking back on our conversation today, we've covered like a lot of really cool things. I think one of the things that's kind of coming to my mind, as I kind of think of a final question to ask, relates to this concept of, you mentioned, we talked about like stress, and how that's kind of a predominant thing of how like these lifestyle choices, from like what you eat to movement and all of that. And I'm thinking about the average person. I'm going to go kind of stereotypical here, but like, they wake up and aren't even human until they have 2 or 3 cups of coffee. And then they're hitting more coffee in the middle of the day, or a Red Bull, because their energy dips. And then they're having stomach issues. So they're having a Tums or some Pepto-Bismol and all these things to kind of medicate just to sort of feel normal. And I think that's become sort of like this phase that a lot of people are in, is where that feeling off kind of becomes the normal. And it seems to me that there's a lot of people coming out of that fog who are just like, I don't feel like myself anymore, and I'm sick and tired of feeling sick and tired. Mm-hmm. So if you could sort of stand on a mountaintop and shout to everybody who's like feeling this way, like, what's the first thing that you would want them to do this week, to get themselves back on track and start feeling better? And it might be too broad brushstroke of a question, but like, what are like one or two things that you would immediately suggest everybody listening to this or watching this starts to incorporate?
I kind of 3 things, but these are all easy and things that people can just do, without having to see a practitioner or, go buy supplements or lab tests. So eat real food. So of course, I can imagine if someone goes to the convenience store, buys a Red Bull and a candy bar, they kind of go hand in hand, or having a Pop-Tart with the morning coffee. There's actually, coffee's not terrible for you. It's just, it's the Starbucks coffees that are loaded with the sugar. So yeah, so if someone has so let's just say morning plain black coffee, or if you don't have it, dairy, since just, a little bit of milk in it, or almond milk, or, whatever. But yeah, so eat real food. So eat the eggs, have your protein. I'm a meat eater. So, I would say eggs, bacon, sausage, or whatever. But, definitely don't eat these ultra processed packaged foods that have 20 ingredients on the label. Eat real foods. I didn't mention avocados. Avocados are amazing. Eat the fat. Fat is not your enemy. So healthy fats are amazing. So that will help. Even if you don't want to go down the path of being 100% gluten free or dairy free yet, just try to eat unpackaged foods. And I'm a big believer in movement. So I enjoy going to the gym. Not everybody does. I mean, I know that's a fear for some people, but if that's not you, that's okay. Go get a walk in. One of my favorite tips is if you after your biggest meal of the day, go for a walk. And if even if it's just 10-15 minutes, that helps your muscles to utilize the glucose, the carbs, so that you don't have the glucose spikes. And if it's a rainy day, or I'm in Texas, you're in Florida, if it's 100 degrees out and we don't want to go walk, just do some air squats. Like do 30-40 air squats, and that can help with that purpose too. So that we talked a lot about prioritizing sleep, so I won't go into that anymore. But yes, eat real food, get your steps in, and then try to stop drinking the coffee after noon, 1 o'clock, so that it'll get out of your body by the time it's time to go to bed.
I love that. Those are all really doable, and I think a lot of people listening are taking that in. I would imagine, number one, I really appreciate your time. I'd imagine there are going to be a lot of people who listen to this who are like, you are speaking my language. I need to get in touch with you. I'm struggling and I want someone's help. Where can people learn more about you, get in touch with you, and work with you?
Yeah, sure. So the easiest way is I use the heal.me platform, where people can learn more about me, my practice philosophy, how to connect with me and work with me. So it's really easy. It's heal.me/Renee. So
heal.me/Renee, RENEE.
Yep. I have been with them for a long time. So I got a really easy URL. So I didn't have to have something crazy. So yep, heal.me/Renee. That's it.
Love that. Love that.
Yeah.
Well, I really appreciate your time. Dr. Prescott has been amazing, and hopefully have you on again at some point in the future.
Absolutely. Thank you so much, Justin. I loved all of your insights, your questions, and really bringing the questions to me that people are really asking out there.
Awesome. That means a lot. Thank you. And we'll talk to you soon. Have a great day.
All right. Thanks. Bye.